condition, gastric dilatation volvulus. What is gastric dilatation volvulus, or GDV? This condition is commonly referred to as bloat, and it is a life-threatening condition that affects large, deep-chested dogs. However, any dog can be affected by this condition. The stomach fills up with gas, which can cause just a simple gastric dilatation, and sometimes it goes no further. But however, GDV occurs when the stomach fills up with so much gas that it twists. The twisting will cause a blockage at both the entrance and the exit to the stomach, which makes this a life-threatening emergency and can only be corrected with surgery. Nearly all breeds have been reported to have had gastric dilatation with or without volvulus. So the volvulus is the twisting. So as you can see here, we have normal stomach anatomy, starting of the twist, kind of what it looks like when it's fully twisted. Symptoms. Symptoms of GDV can include non-productive retching, meaning they're dry heaving and nothing's coming up, hypersalivation, restlessness, acute abdominal distension, or the belly becomes distended, you'll see it swell. Dog may become recumbent and depressed, panting, weakness, and or collapsing when they try to stand up. This condition develops quickly and often without any warning, so it's imperative that you as a dog owner recognize the symptoms early on, because the longer this goes on untreated, the less likely your dog is to survive the condition. Diagnostic tests. So typically veterinarians will begin diagnostics by running a full blood panel, or CBC, a serum chemistry, blood electrolytes, and a urinalysis. All of these tests are used to rule out any other potential diseases that can mirror GDV, but abdominal x-rays are used to confirm the GDV diagnosis, while an electrocardiogram, or an ECG, is used to evaluate any presence of cardiac arrhythmias, which occurs as the condition progresses. Another commonly performed test is a blood gas analysis to evaluate the severity of any respiratory compromise. So here we have a radiograph showing the distended stomach of the dog, and it is compressing on all of these organs. Treatments. The initial treatment of GDV begins with an aggressive stabilization of shock with IV fluids. IV medications used are typically pain medications, electrolytes, lidocaine, and antibiotics. Sometimes a blood transfusion is necessary if the dog is showing any signs of severe bleeding. So once you've gotten those IV fluids going, the stomach is decompressed, which uses a procedure called a trachetization, which is performed by using a large needle that you insert through the abdomen and into the stomach. And the hope is that this will release the trapped air. A tube can also be placed from the mouth to the stomach in an attempt to empty the stomach, but if the stomach is twisted up, a tube may not be able to pass through the entrance of the stomach to get all the way in. Once the patient is stabilized, surgery is required to fix the stomach, which corrects the position of the stomach and restores that blood supply to any major organs or vessels. Sometimes, if the stomach has been twisted for long enough, necrosis can be present, so part of the stomach or the spleen may need to be removed if that's the case. What organs does this affect? So, the obvious ones, GDV affects the stomach and the spleen, and the stomach will fill with gas and twist over, which causes a blockage to that blood supply, the stomach, and the spleen. Because of this, the spleen can also twist as a result of GDV. As you can see in this last diagram, spleen's down here, so as this twists, it can kind of take that with it. As the stomach grows more distended from the trapped air, it will press on other organs. So that includes the lungs, which can cause breathing difficulties, which is why I mentioned that test that they run earlier to make sure there's no respiratory compromises. The lack of blood supply can reduce the blood flow to the heart, which can reduce the cardiac output. That will lead to a cardiac arrhythmia and low blood pressure. Other abdominal organs, like the liver, can also be affected by a reduction in blood flow. Prevention. So GDV has no single cause, so there's several different things you can do to prevent it. You can feed smaller meals more frequently, restrict activity for 1 to 2 hours after feeding, avoid using a raised food bowl, do not let the dog intake a large amount of water all at one time, and avoid any kind of strenuous activity on a full stomach. So don't take them for a walk after they eat their dinner. Gastropexy is a preventative procedure that can be performed usually during a routine spay or neuter. It's usually recommended for those large, deep-chested breeds of dogs. This procedure can help prevent the stomach from twisting if bloat is occurring, but it will not prevent it. It can just help reduce the severity. And a gastropexy is where they will adhere the stomach to the abdominal wall in order to help prevent that stomach from twisting over as much as it would without that security measure.